Boys, question 22b asks students to demonstrate how 2 action areas of the Ottawa Charter could be used to address cancer. So you had to talk about 2 areas of the Ottawa Charter and you had to relate them to cancer. And this was worth 7 marks. If we go and have a look at our syllabus, what we'll find is that in our last dot point, health promotion based on the 5 action areas of the Ottawa Charter, you'll see the Ottawa Charter in action here, which is what we're looking at. That's where it comes into it. We go and view this response. So again, demonstrate how 2 action areas of the Ottawa Charter could be used to address cancer. So this person's looked at building healthy public policy and develop personal skills. So we go down to building healthy public policy. They've also broken up among skin cancer, breast cancer, and lung cancer. So firstly, building healthy public policy is the government's initiative to allow for decreasing of specific diseases, thus promoting cancer to be treated. Government initiatives can allow for skin cancer to be treated through instigation of healthy practices. For example, government initiative to enforce the wearing of sunscreen at public pools, coming back to our legislation, building healthy public policy. Building healthy public policy can also address lung cancer through legislation that prohibits the causation factors to be committed. For example, enforcing no smoking zones in pubs or clubs, which has been implemented. Breast cancer can also be addressed through the compulsory checkups for women, legislatively enforced through the use of mammograms. There's some really nice terminology being used in that answer there, as well as breaking up amongst the 3. Second part is the developing personal skills can also allow for cancer to be addressed. Develop personal skills is the gaining of knowledge and education, so an understanding of the area about the health issue. Develop personal skills can firstly address skin cancer through increased knowledge towards risk factors of the disease, for example, education groups about the application of sunscreen to prevent skin cancer. Breast cancer can also be addressed through the education towards preventative measures such as eating habits, which can be enforced to minimise the chances of obtaining this disease. And finally, lung cancer can be addressed through education about the effects of smoking, thus empowering individuals to make positive health decisions. And that's why that's a 7 out of 7. So again, the 2 areas of the Ottawa Charter have been covered. It's been related to cancer, and more specifically, skin, lung, and breast. Been able to emphasise how it's occurred and why, which makes this a really good answer. And again, what we know is we've got some highlighting here. There's one of the areas of the Ottawa Charter, and there's the second one right there. Okay.